Welcome everyone. Today we are going to learn about some definitions related to seizures in children. Why it is an important topic to learn because more often than not what happens when children come with multiple episodes of seizure to our outdoor or indoor get admitted to our indoor, what happens is most often the diagnosis written is seizure disorder, irrespective of the fact that the child might be having actually febrile seizures, the child might be having epilepsy, the child might be having a genetic epilepsy. So we just write seizure disorder. That is a blanket term that doesn't help us in the diagnosis of the child. So what we are going to learn today is we are going to learn about what are the various accepted definitions related to seizures in children. Second thing is we are going to learn what is the recent 2024 classification of seizures in children according to the International League Against Epilepsy, that is ILAE. So let's proceed. So what is a seizure? What is meant by an epileptic seizure? An epileptic seizure refers to the sudden and transient occurrence of signs and/or symptoms that results from abnormal, excessive, or synchronous neuronal activity in the brain. So, what is a seizure? Externally, we see a child convulsing, but what is the definition? It is the sudden and transient occurrence of signs or symptoms. Sudden and transient. It has to be sudden onset and it has to be short lasting, transient. Why does it happen? It results from an abnormal, excessive, or synchronous neuronal activity in the brain. That means it is not normal brain activity, it is abnormal activity, and it is abnormally excessive, not abnormally low, abnormally excessive. Next, what is focal seizure? What happens in focal seizure is that in focal seizures, the first clinical and/or EEG changes suggest initial activation of a system of neurons limited to part of one cerebral hemisphere. So we learned the definition of epileptic seizures. That means seizures. Among that, one subgroup is focal seizures. What happens in that? A group of neurons limited to one cerebral hemispheres get activated initially. Later on, what happens? That doesn't matter. Later on, it may remain confined to that one cerebral hemisphere. Later on, it may proceed or progress to both hemispheres also, but the initial activation is limited to one cerebral hemisphere. That is called focal seizure. The older terms like partial seizures are not accepted nowadays, so it's better if we use the term focal seizures. Classification: previously we used to classify as simple partial seizures, complex partial seizures, something like that, but now the accepted terminology is focal aware seizures or focal seizures with impaired awareness. Otherwise we can call it as focal seizure with intact awareness, focal seizure with impaired awareness. So what is meant by focal aware seizures? Basically it refers to focal seizure with no alteration in consciousness or awareness. And what is focal seizure with impaired awareness? The name is self-explanatory. That is, the focal seizure is associated with altered consciousness or awareness of the surroundings. So that is the basic classification of focal seizures. So obviously we'll learn after focal seizures, we'll learn about generalized seizures. What is meant by generalized seizure? The first clinical and/or EEG changes indicate synchronous involvement of both hemispheres. So for a seizure to be classified as focal or generalized, we have to see what is the initial activation. If the features are suggestive of initial activation of only one cerebral hemisphere, we'll call it as focal seizure. If the initial activation is involving both cerebral hemispheres, we'll call it as generalized seizures. So what are febrile seizures? Febrile seizures are seizures that occur between the ages of 6 months and 60 months, that is 6 months to 5 years, with a temperature of more than or equal to 38 degrees Celsius or 100.4 degree Fahrenheit, which are not the result of CNS infection or any metabolic abnormality in the absence of a history of prior afebrile seizures. These four things must be there to call it as a febrile seizure. What are the four things? It must occur between the ages of 6 months and 60 months. That means any child who is having seizure less than 6 months or after 5 years of age is not a febrile seizure. Second thing, for the seizure to be called febrile, it must be associated with fever. That means the temperature must be at least 38 degrees Celsius. Third thing, it must not be resulting from any abnormality of the brain which affects the excitability. For example, a meningitis will increase the excitability of the brain. A electrolyte abnormality will increase the excitability of the brain. So the seizure must not result from any other cause which affects the excitability of the brain. That means basically what we are saying is the seizure is resulting from the fever and not any other cause. So it is kind of like a diagnosis of exclusion. And in the absence of a history of prior afebrile seizures, that means the child must not have had any seizures in the past which are not associated with fever. If a child has had any seizure in the past which is not associated with any fever, that means this might be a fever triggered seizure also. For a detailed discussion on febrile seizures, I'll post the link here. You can check out that video also. Next is what is acute symptomatic seizure or acute provoked seizure. Acute symptomatic seizure refers to seizure secondary to acute problem affecting the brain excitability. For example, any electrolyte imbalance, any meningitis, any encephalitis, tumor or stroke. So basically, suppose a patient has had profuse diarrhea and profuse vomiting and that has resulted in a electrolyte abnormality, for example like hyponatremia or hypokalemia or hypocalcemia, something like that, and the seizure has developed as a result of that, then we'll call it as acute symptomatic seizure. So acute symptomatic seizure and acute provoked seizure are basically caused by something affecting the brain excitability. This must be ruled out before calling febrile seizure, like we discussed in the previous slide. What is an unprovoked seizure? Basically, in any case when where we cannot find any precipitating cause of seizure, like electrolyte abnormality, trauma, hemorrhage, fever, anything that might cause seizure in the child, we are not able to find, then we can call it as unprovoked seizure. What is remote symptomatic seizure? Remote symptomatic seizure means remote means distant. So remote symptomatic seizure refers to a seizure occurring secondary to a distant brain injury. Distant brain injury means like for example an old stroke or an old hemorrhage. What is reflex seizure? Reflex seizures are precipitated by various sensory stimulus. For example, visual stimulus, auditory stimulus, tactile response, somatosensory stimulus, proprioceptive, praxis, eating, bathing in hot water, anything. Any sensory stimulus that is precipitating seizure in the child, we can call it as reflex seizure. So, what is epilepsy? Epilepsy is a disorder of the brain that is characterized by an enduring predisposition to generate seizures and by the neurobiologic, cognitive, psychological, and social consequences of this condition. This is very important because many of the doctors confuse the terms epilepsy and seizure disorder more often. They use the terms interchangeably. They think that epilepsy and seizure disorder are same. It is not same. We'll discuss what is seizure disorder later on, but for now we'll focus on what is epilepsy. So epilepsy basically refers to the disorder of the brain characterized by enduring predisposition to generate seizures. Enduring predisposition to generate seizures means the child is having some abnormality because of which the child is prone to developing recurrent seizures. That is called epilepsy. And this the seizures just are not epilepsy. Epilepsy also refers to the consequences of seizures. What are the consequences? The consequences can be neurobiologic, the consequences can be cognitive, the consequences can be psychological, and the consequences can be social also. For example, a child is having recurrent seizure episodes since childhood. Now he is 12 or 13 years old, or now he is 18 years old. Because of his repeated unprovoked seizures, he is not able to perform his daily activities, and he is not able to play his role in the society. For example, he cannot become a driver of a vehicle, he cannot go swimming, he cannot go driving by himself. So that is a social consequences of the seizure. So this also comes under the umbrella term of epilepsy. So what is the diagnostic criteria for epilepsy? At least one unprovoked seizure may be there, must be there, plus enough EEG evidence to convincingly establish an enduring predisposition to develop recurrences. That means the child must have had at least one unprovoked seizure. Unprovoked seizure means a seizure which has developed without any cause which can be established. For example, dyslipidemia, trauma, fever, any cause that can be attributed to the seizure has not been able to found, and the EEG evidence is there which is suggesting that the child may develop recurrent seizures in the future. That must be there. Or more than equal to two unprovoked seizures in a time frame of more than 24 hours between them. That means the child must have had two or more unprovoked seizures with more than 24 hours of gap between them. Then we can also call it as epilepsy. So what is seizure disorder? The term that is often confused with the term epilepsy. Seizure disorder, that is a general term that is usually used to include any of the several disorders including epilepsy, febrile seizure, single seizure, symptomatic seizure, etc. That means what is epilepsy? Epilepsy is basically uh, any all the seizure disorders, all the febrile seizures, all the acute symptomatic seizures, everything that we discussed till now come under the term seizure disorder. So we can use the seizure disorder as a general term to include all, but any child who is coming as a who coming with the complaint of seizure, we if we tell that the child is having seizure disorder, that doesn't help us much, because if it is an acute symptomatic seizure, we have to find out the cause and treat it. If it is a febrile seizure, we have to reduce the fever. If it is a meningitis, we have to treat the infection. And if it is an epilepsy, we have to start anti-epileptic therapy. So calling it as seizure disorder doesn't help us in the diagnosis or management. Rather, we have to point out what exactly is the terminology. What is epileptic syndrome? Epileptic syndrome refers to one or more specific seizure types having a specific age of onset and specific prognosis. For example, think about the children having West syndrome. Usually, the seizure starts in the infancy. Usually, it is of myoclonic type. Usually, it is well responsive to treatment, that is ACTH. So this is a specific type of seizure, that is myoclonic seizures, specific age of onset, that is infancy, and having a specific prognosis. So we can call it as epileptic syndrome. What is epileptic encephalopathy? If the epileptic syndrome is associated with severe EEG abnormality, for example generalized slowing, that results in cognitive and other impairments, it is called encephalopathy. That means epilepsy syndrome plus severe EEG abnormality, that is called epileptic encephalopathy. What is developmental encephalopathy? Developmental encephalopathy refers to the underlying etiology contributing to a developmental delay independently of the patient's seizure burden and EEG abnormality. That means a patient is having two issues. One is developmental delay, another is seizure disorder and EEG abnormality. So the developmental delay and the seizure burden both are independent of each other. For example, a child is having mild developmental delay. The developmental quotient might be around 75 to 80%, but the seizures might be very severe. That means the child is having recurrent refractory seizures all throughout the day. That means the developmental delay is mild but the seizure is very severe. So the developmental delay and seizure burden are not related to each other. So that is called developmental encephalopathy. What is genetic epilepsy? Epilepsy syndrome is the direct result of a known or presumed genetic defect that is not causative of a brain structural or metabolic disorder other than the epilepsy. This is called a genetic epilepsy. For example, think MECP2 gene mutation. MECP2 gene mutation causes Rett syndrome. Rett syndrome can cause repeated seizure-like episodes in the child. So this is a genetic etiology that is not causative of a brain structural disorder. Rett syndrome doesn't cause any structural abnormality in the brain, but it causes repeated seizures in the child. So we can call it as a genetic epilepsy. The outdated term is idiopathic epilepsy. Previously, we could not find any cause for most of the children, so we used to cause idiopathic epilepsy. But now with the advent and availability of whole exome sequencing and genetic analysis in lot of places, the term idiopathic is outdated. So we have to look for genetic causes, and if it fits, we have to call it as genetic epilepsy. What is structural epilepsy? Structural epilepsy refers to epilepsy syndrome caused by an underlying structural brain disorder that may or may not be genetic. For example, think that a child is having an arachnoid cyst, or the child is having holoprosencephaly. This is a structural defect. Or for example, a corpus callosal agenesis. The corpus callosal agenesis is a structural defect that is resulting in repeated attacks of seizure, or that is resulting in epilepsy of the child. So that is called a structural epilepsy. The outdated term for this is symptomatic epilepsy, that is not used nowadays. What is immune mediated epilepsy? Epilepsy is occurring secondary to immune mediated CNS inflammation. For example, autoimmune encephalitis. So that is caused by antibodies in the CSF. So that can be an example of immune mediated CNS inflammation. So we'll use the term immune mediated epilepsy. Infectious epilepsy. Epilepsy is secondary to chronic infectious conditions rather than acute infections. For example, HIV infection or tuberculosis. Now coming to the most important part, what is the International League Against Epilepsy, that is ILAE classification of epileptic seizures in 2024. Mainly the ILAE classifies it into four groups. One is focal, second is generalized, third is unknown whether focal or generalized, and fourth is unclassified. So there are two things to consider here. First, what are the classifiers, and second, what are the descriptors. Classifiers means we have to define the seizure types, what is the direct influence on patient management by guiding the syndrome diagnosis, and we have to decide the therapeutic we have to take the therapeutic decisions and define the prognosis. What are the descriptors? The significant seizure characteristics that indirectly contribute to patient management along with other clinical data and modalities. So basically we'll remember the four types, that is focal seizures, generalized seizures, unknown whether focal or generalized, or we can call it as just as unknown. Fourth is unclassified. So these are the four types: focal, generalized, unknown, and unclassified. So what is focal? Focal means originating within the networks limited to one cerebral hemisphere, that we discussed in the first slide itself. For each seizure type, ictal onset is consistent from one seizure to another with preferential propagation patterns that may involve the contralateral hemisphere. What does it mean? For example, a child has had 3 episodes of seizure in the last 24 hours. In all the 3 episodes of seizures, the seizure used to start from the left hand itself, and if not treated, within 2 to 3 minutes, the seizure used to progress from the left hand to the right hand and later on the whole body. So for each seizure type, the ictal onset is consistent from one seizure to another. Each seizure episode started from the same site. So that indicates preferential limitation to one cerebral hemisphere. So that is the definition of focal seizure. In some cases, however, there is more than one network and more than one seizure type, but each individual seizure type has a consistent site of onset. For example, discuss the second example. A child was having seizure, 3 episodes of seizure in the last 24 hours. In the first seizure, the seizure started from the left hand and later on progressed to the whole body. In the second seizure, the child started having seizure from the right hand and later progressed to the whole body. In the third seizure, the child started having seizures from the left foot and later on progressed to the whole body. So each individual onset is from different site, but the site always was limited to one side or limiting to one cerebral hemisphere. So that is called focal seizure. Depending upon the preservation or impairment of consciousness, the focal seizure can be divided into three types: preserved awareness, impaired awareness, or unknown state. We discussed that before, and all of those can be with or without observable manifestations. Important to know here is that the focal seizure can very often progress to bilateral tonic-clonic seizures. So when we can call it focal to bilateral tonic-clonic, we'll call it as focal to bilateral tonic-clonic when the focal seizure in which the ictal activity propagates to both hemispheres, while the semiology evolves to impairment of consciousness and bilateral tonic muscle activation, followed by a clonic phase with progressive decrease in frequency due to gradual increase in the duration of silent periods interrupting the tonic muscle activity. So let's simplify it. For example, the child had a seizure which started from the left hand of the left hand. So that indicates that the child had ictal onset from one hemisphere. But later on, if untreated, the child's left hand seizure gradually progressed to the whole body. So that means the ictal activity propagated to both hemispheres. While the semiology means the appearance of the seizure, evolves to impairment of consciousness. That means when the seizure progressed to involve the whole of the body, the child's consciousness became impaired. That means impaired consciousness. And later on, the child progressed through a tonic and clonic phase. Tonic means sustained muscle contraction, increased tone, and followed by clonic phase. Clonic phase means intermittent rhythmic contraction and relaxation. So as the child's seizure was focal in onset, gradually progressed to involve both hemispheres, becoming generalized, affected the consciousness, and later on progressed with the tonic and clonic phases. We'll call it as focal seizure to bilateral tonic-clonic seizure. What is the second type? Generalized. Generalized seizure can be motor type or absence type, and the motor type can be tonic clonic or other than tonic clonic. Other than tonic clonic can be several types like clonic, myoclonic, atonic, astatic. A lot of the classifications are there, but that is beyond the scope of discussion of today. So just remember that the generalized seizure, that is the second type, can be motor or absence, and the motor type can be broadly classified to tonic clonic and other than tonic clonic. Third is unknown. Unknown means when there is information available to characterize certain aspects of seizure, but it is insufficient for a clear classification as focal or generalized. That means the parents don't have a video recording. The parents are not able to tell whether the child's seizure initially started from one part of the body and later progressed, or it was starting from the whole of the body itself. So they are not able to tell clearly, or the child's seizure is of some abnormal semiology from which we are not able to point out whether it is limited to one cerebral hemisphere or not. So when it is unclear, we'll call it as unknown. And the unknown seizures, depending upon the consciousness, can be classified in the same way as focal seizure, that is preserved consciousness, impaired consciousness, and unknown state, and all of them can be with or without observable manifestations. In addition, the unknown seizures can be focal and can be generalized also. Last is unclassified. Unclassified means it is not fitting into anything. When there is no available information to characterize the seizure, but the clinician is confident that the event is an epileptic seizure. For example, think that the child was brought to the outpatient department. The complaint was, the parents complained that the child had an episode of involuntary movement at home, and this involuntary movement was associated with involuntary passage of stool and urine. But right now, in front of your own eyes, the child is not able to, the child is perfectly normal, the child is not having any convulsion, and the parents are not able to describe the semiology also, that how the seizure happened. So you know for sure that this episode was a seizure because it was associated with involuntary passage of stool and urine, but the parents don't have a video and the parents are not able to describe or enact this how the seizure happened. So at that point of time, you will classify it as unclassified, but later on when more information is available, you will try to classify into one of these three types. So thank you. I hope the definitions were clear, and from now on, whenever you get a child or a patient with seizure, you will use the particular term, or you use the correct term according to the definition and according to the diagnostic criteria, and not just write the term as seizure disorder broadly. Thank you.